Hello, my name is Philip Sappi, and this is my tobacco cessation program for ASHKI. This program will outline health goals for tobacco cessation and provide ASHKI with a comprehensive plan to eliminate his tobacco dependency. Patient background. Tobacco product dependency is a problem that negatively affects many young Americans. This presentation was designed to help ASHKI, a 17-year-old Native American boy living in rural South Dakota, quit his tobacco dependency. He uses chewing tobacco and smokes approximately 12 cigarettes each day. ASHKI's father uses tobacco for ceremonial purposes but does not engage in recreational use. ASHKI has used tobacco for ceremony but engages in recreational tobacco use daily. ASHKI has explained his financial concerns with continuing tobacco use. Additionally, he expressed his concerns with affordability of tobacco cessation treatment. I've prepared several resources at the end of this presentation that will help you with affordability concerns. Health goals. To increase the likelihood of tobacco cessation, we will establish measurable and obtainable health goals with ASHKI. The most important factor when setting up goals with a patient is goal agreeability. ASHKI and I have planned health goals that ASHKI finds achievable. Previously, ASHKI attempted to quit smoking entirely, but this only lasted for about 5 days. The goal of this presentation is to eliminate ASHKI's tobacco product use after enrolling in our 12-week program. ASHKI has agreed to gradually reduce his tobacco product use each week for 12 weeks. ASHKI, this program will improve your understanding of the side effects and health risks associated with tobacco dependency. By the end of this 12-week course, I will evaluate your understanding of continued tobacco product use. I expect that you will be able to state the health risks associated with cigarette smoking, vaping, chewing tobacco, electronic cigarettes, and hookah. Your ability to recognize the health risks associated with tobacco products will give me a better idea of the effectiveness of this program. I've prepared an educational session for the side effects and health risks associated with tobacco product use. It is important for patients enrolled in this program to understand that there are many health risks associated with chronic tobacco dependency. Secondhand tobacco smoke exposure can lead to acute and chronic health problems. As ASHKI described, he has been frequently exposed to secondhand smoke throughout his life. According to the Centers for Disease Control and Prevention, CDC, there is, quote, no safe level of exposure to secondhand smoke. Even brief exposure can cause immediate harm, unquote. Centers for Disease Control and Prevention 2023. Recognizing the impact of secondhand smoke is important for avoiding the health risks associated with smoking. Chemicals in cigarettes. Cigarette smoking exposes people to harmful chemicals. Commercial tobacco products contain chemicals such as benzene, toluene, butane, cadmium, ammonia, and hydrogen cyanide. Centers for Disease Control and Prevention 2023. Exposures to these chemicals can cause a wide variety of chronic health problems. For example, increased exposure to benzene affects bone marrow and increases the risk for leukemia. Centers for Disease Control and Prevention 2023. Chronic use of tobacco products can lead to health problems such as coronary artery disease, lung cancer, and COPD. Additionally, smoking can lead to, quote, stroke, blindness, deafness, back pain, osteoporosis, and peripheral vascular disease, unquote, West 2017. Prompt tobacco cessation is necessary to mitigate the health risks associated with smoking. Culture and community tobacco concerns. Askey asked me during our first encounter how his culture impacts his tobacco product use. He expressed concerns that his culture made him more susceptible to tobacco dependency. Additionally, Askey was wondering how his experience compared to other Native American tribes. Askey's understanding of his culture's perspective on tobacco product use is important for his recovery. In the article, A Southwestern Tribal Perspective on Traditional and Commercial Tobacco, Priscilla Sanderson encourages providers to interview tribes to, quote, understand dimensions of tobacco use before moving forward with tobacco cessation programming, unquote, Sanderson, 2018. A notable finding in this study is that men within the Southwestern tribe were more tolerant of tobacco use amongst tribal youth when compared to the Southwestern tribal women, Sanderson, 2018. Askey and his tribe members were open to explaining their unique dynamic. Askey's father was more permissive with tobacco use when compared to Askey's mother and grandmother. Askey's father did not condemn tobacco use outside of ceremonial purposes. There have been many common misconceptions of tobacco products and their effects on the body. Education on the different types of tobacco products and their impact on users is necessary for thorough tobacco education. A U.S. national survey found that more than 50% of respondents believe that, quote, nicotine gum and patch to be as harmful or more harmful than cigarettes to overall health and, specifically, to causing cancer or heart attack, unquote, Valenti, 2019. Nicotine gum and patches do not contain the cancer-causing agents that tobacco products contain. These products may be necessary in preventing nicotine withdrawal during the quitting process. Cigarette smoking is the most common source of tobacco consumption. People often believe that health problems can be avoided by smoking in moderation. However, even moderate cigarette smoking is associated with negative health outcomes. According to the World Health Organization, cigarette smoking is, quote, estimated to be responsible for over 7 million deaths annually worldwide, unquote, Feeney, 2022. These products not only affect the lungs, but many other body systems as well. Hookah and electronic cigarettes. There is a common misconception that hookah and electronic cigarettes are safer when compared to cigarettes. In the article, Misperceptions of Nicotine and Nicotine Reduction, the Importance of Public Education to Maximize the Benefits of Nicotine Reduction Standard, Andrea Valenti found that people are more likely to abuse an alternative tobacco product when they believe the product is less harmful than a cigarette. Valenti, 2019. Hookah and electronic cigarettes still contain unsafe chemicals that are found in cigarettes. Abstaining from these alternative forms of tobacco products is necessary, since the health impact, when compared to cigarettes, is still debatable. Vaping. Vaping products have become a popular alternative to smoking, particularly in adolescent populations. There is a common misconception that vaping is a safe alternative to cigarette smoking. However, vape products expose a user to, quote, metals and metalloids, arsenic, chromium, lead, and nickel, aldehydes, tobacco alkaloids, and hydrocarbons, unquote, Feeney, 2022. Depending on the vape device, users may be exposed to these chemicals more often than a cigarette. Askey's goal in this program is to reduce his cigarette use by 7 cigarettes each week for 12 weeks. Following this program goal will fulfill his agreed-upon health care goal. Every 4 weeks, I will meet with you and discuss your progress with quitting smoking. You will make a log of your daily cigarette use and share this at each meeting. Addressing concerns. During each encounter, I will ask you if you have any concerns about the current plan. The plan can be modified to your needs as you progress through the program. Ashke asked about medications that can be used for smoking cessation. Over-the-counter options for smoking cessation include nicotine patches and gum. The pharmacological therapies approved by the Food and Drug Administration for tobacco cessation include, quote, buprenorphine, varenicline, and NRT, nicotine replacement therapy, unquote, CLOC 2023. Evaluating patient understanding. At each meeting, we will discuss the associated health risks with the different types of tobacco products. Additionally, I will test your knowledge of tobacco products and common misconceptions with each type of product. This will ensure that the teachings in the program are effective. Education materials will be provided on smoking cessation and the side effects associated with tobacco products at each session and in this PowerPoint presentation. Healthy People 2030. The education provided in this tobacco cessation program satisfies the goals outlined in Healthy People 2030. The relevant tobacco use goals of Healthy People 2030 are to reduce cigarette smoking in adolescents and reduce smokeless tobacco product use in adolescents. U.S. Department of Human Services 2023. Improve counseling. Many smokers require the help of a medical professional to decrease or eliminate their smoking habits. Healthy People 2030 aims to increase the amount of people who seek professional help. U.S. Department of Human Services 2023. People with tobacco dependency benefit from professional help when attempting to quit. Medical providers can provide resources and medicational therapy to improve the patient's chances of quitting. Evaluating educational outcomes. Each session during the 12-week program will work towards the overall goal of eliminating Ashke's tobacco dependency and increasing his knowledge of the harmful effects of tobacco products. Progress will be evaluated every 4 weeks through self-reporting and testing Ashke's knowledge. The program will be successful when Ashke no longer feels the urge to start his tobacco use habit again. Changes to the tobacco cessation plan. The previous tobacco cessation plan needed to be updated to better accommodate the needs for change during the 12-week program. This version provides more resources for tobacco cessation and side effects associated with chronic tobacco dependency. Additionally, this version examines the patient's needs at 4-week intervals to assess the need for change to the program. This approach was initiated in this version of the health plan to help tailor the program to the individual. Useful resources. The Centers for Disease Control and Prevention provides information on tobacco cessation and continued abstinence from tobacco products. The CDC's Smoking and Tobacco Use Resource Guide highlights the different types of treatments available to people who are trying to quit smoking. Additionally, the CDC notes that most private insurance plans, Medicaid and Medicare, have to cover tobacco cessation treatments under the Patient Protection and Affordable Care Act. The Centers for Disease Control and Prevention 2021. 1-800-QUIT-NOW. This hotline is important for tobacco cessation According to the CEDC, this hotline offers, quote, counseling, referrals to local programs, and free medication to people who want to quit tobacco, unquote, Centers for Disease Control and Prevention, 2021. This resource is necessary for continued support in obtaining information outside of this 12-week program. Additionally, this resource can connect patients with local resources for continued support. TIPS campaign. The TIPS campaign is aimed at reducing smoking in adolescents and adults. This campaign has former smokers explain their difficulties with managing their smoking-related illnesses. It is important for smokers to realize the extent of the physical and emotional damage tobacco products can cause. That concludes the end of my presentation. Thank you for watching.